Hi, I'm Emily.
I'm Emma.
Today we're going to talk about HIV. HIV is a major health crisis. HIV stands for Human Immunodeficient Virus. It is a blood-borne virus. It is acquired through sexual contact through the exchange of body fluids. These fluids can include blood, semen, vaginal fluid, rectal fluid, and breast milk. 1.2 million Americans live with HIV. 1 out of 8 don't realize that they have HIV. Gay and bisexual men are the largest number of new diagnoses.
HIV is so prevalent in today because 91% of new HIV infections are transmitted through those who do not know they have been diagnosed. HIV prevention and intervention have been proven to reduce HIV transmission. Testing causes behavior changes that reduce the risk of transmission. So to expand on that, those who have been diagnosed with HIV are less likely to go into a situation and not be protected and not let their partner know that they have HIV and they need to reduce the risk of spreading HIV. So early intervention can also preserve health of those living with HIV.
Our Healthy People goal given to us from Healthy People 2020 is 1. To reduce new HIV infections.
2. To increase the access to care.
3. Improve health outcomes for people living with HIV.
And 4. Reducing HIV-related disparities and health inequities.
Our 2 student outcomes for you to learn today from this video is 1. How HIV is transmitted.
And 2. Knowing the risks of HIV.
These are some risks associated with HIV. In the U.S., it is very common that HIV is spread through vaginal or anal sex without using a condom.
It is most risky through anal sex.
Unprotected oral sex is also a risk.
The use of contaminated needles.
And with contaminated needles can live up to 42 days with the HIV virus on it.
Also contact between broken skin.
And transfusion of infected blood.
Unlike a common cold or flu, which are also viruses that only last up to a couple of days, HIV is much more serious.
Once you're diagnosed with HIV, the person remains HIV positive for their entire life.
HIV attacks the body's T cells, which help you stay healthy.
When attacking the body's T cells, it leaves a person vulnerable to infection and disease.
HIV comes in 3 separate phases. Phase 1 is an acute HIV infection stage. This happens 2 to 4 weeks after the onset, in which patient has flu-like symptoms. These symptoms can be described as the worst flu ever. Symptoms include a headache, a fever, swollen glands, sore throat, muscle and joint aches, chills, and also a rash. People who think they might be infected need to seek care immediately. Starting treatment at this stage has very significant benefits to your health. At this stage, the virus uses T cells to replicate and then destroys the T cells in the process. At this point in the stage and in the infection, you are very high at risk for transmitting HIV at this stage.
Phase 2 is the clinical latency stage. Within this stage, patients experience no infectious symptoms. Because they experience no infectious symptoms, they don't find it necessary for testing, which just continues the spread of HIV. In this stage, people can last up to 10 years with no treatment before moving on to further, more extreme stages. But if they get treated, they can remain in this stage without having to move on to more serious symptoms.
The 3rd stage of HIV is when the HIV becomes acquired immunodeficient syndrome, which is also known as AIDS. Symptoms of AIDS include weight loss, recurring fever, extreme tiredness, diarrhea, pneumonia, and even more. This phase can be extremely serious and even fatal. Your T cells fall less than 200 when an average person has 500 to 1600. Your life expectancy with no treatment is only about 3 years. However, with using treatment, a patient can live a normal lifespan with no cure, but it can be controlled. AIDS is the most severe phase of HIV. People with AIDS have such a badly damaged immune system that they can get an increasing number of severe illnesses called opportunist infections.
But there's good news! By using HIV medications, also called antiretroviral therapy, or also known as ART, consistently, you can prevent HIV from progressing to AIDS. ART helps control the virus so that you can live longer, healthier, and greatly reduce the risk of transmitting HIV to other people. Hi, I'm Emily. I'm going to be your nurse today.
Hi, I'm Emma.
So what brought you in today?
Well, I've just been having this super bad fever, and I've been experiencing some joint pains and super bad headaches and a little bit of a rash, and just figured I should come in and try to get it checked out.
Okay, yeah, these are some crazy symptoms. I'm going to have to ask you a couple personal questions. Is that okay?
Yeah.
All right. Have you been having any unprotected sex lately?
Yeah.
You have? Okay. Do you happen to know your partner's history at all? Sexual history?
No.
No. Okay, that's completely fine. Just to let you know, you should always be wearing a condom if you're having sex with someone you don't know, just for safety, you know. Never want anything bad to be spread. These symptoms do tend to go along with HIV, and I know it sounds like a really scary term, but there's definitely some preventions we can go through, and that's only if you're tested positive for sure. But from what I can see, you're experiencing symptoms from stage 1. So, just to warn you, stage 1 is the most infectious stage. So you will be experiencing crazy symptoms, and you're very likely to transmit it to others. So, until we get any test results back, I highly advise that, you keep body fluids away from others just to prevent this, disease from spreading further. Alright? Yeah.
Okay.
We'll just do some testing and just let you know, worst case scenario, if you are diagnosed, it's not a terrible thing. It is a lifelong disease, but it is controllable, so you'll live.
Okay. Thank you.
Let's talk out this scenario.
I came in as a patient sharing and showing obvious signs of having a phase 1 HIV infection.
As a nurse, I made sure not to diagnose her on the spot. I made sure to ask my patients specific questions that could help lead me to the cause of these symptoms.
As a patient, she made me feel super comfortable by asking if it was okay to ask certain personal questions. This helped me open up to my nurse to share my personal experiences.
As a nurse, it's really important to make your patient comfortable, especially with dealing with HIV and sexual history, because often patients don't open up about that. When hearing about my patient's sexual history, I made sure to have health promotion tips placed in there to help educate my patient about how to wear condoms when having sex with people that you don't know their past history.
She then went on to explain to me what my symptoms could possibly be and also my possible outcomes for the rest of my life without scaring me.
It's important to give your patient all the information they need and what they could be dealing with, especially once they're diagnosed. But it's also important not to scare them. Alright, let's review our 2 student learning outcomes that we wanted you guys to know at the beginning of this video. The first one was, how is HIV transmitted? As we discussed earlier, HIV is a blood-borne virus, which means that it's spread through sexual contact or contact between bodily fluids. These fluids can be blood, semen, vaginal fluids, or anal fluids, and breast milk.
The second learning activity and outcome that we wanted you to take from this video was knowing the risks of HIV. These risks include unprotected sex, oral, anal, and vaginal, contaminated needles, broken skin contact, and the transfusion of infected blood.
It's always important to know the symptoms of HIV so you can know when to be tested.
Because remember, 91% of those who spread the disease are those who do not know that they have been diagnosed with HIV.
always be tested.